普通话的翻译请拨打1347966411，ID 密码为911043127，井字号。再重述一次，今天有普通话的翻译专线，请拨打1347966411，ID 密码为911043127，井字号。请各位进入这个专线的家长跟贵宾，请务必把你的麦克风关静音，以免背景音乐嘈杂，影响其他收听的权益。好，谢谢 ，Thank you.
Thank you very much, Mr. Chen. And then can we please have the Spanish interpreters read the instructions?
Sure. For Spanish, please call the number 347-966. Para español, por favor, llame el número 347-966-4114. Una vez usted conteste, por favor, digite el número 634-889-87 numeral. De nuevo, marque el 347-966-4114. Después de eso, el 634-889-87 numeral. Por favor, recuerde tener su micrófono apagado para no interrumpir la interpretación. Gracias.
Thank you, Carolina. For a second there, I thought I understood Spanish at the beginning. And we'll continue to put this information in the chat for all of people that join later, and it will also be on the bottom of the slides. So before we begin, I just want to invite everyone that is on the call to quickly jump into the chat and let us know what school you're coming from. I know the superintendent, Nathan, and myself love to see all the different schools that are represented at our meetings. So go ahead and tell us what school your family is a part of. We know we like to see that kind of stuff. And then I'm going to go ahead and turn it over to Nathan and I guess Dr. Mike to just have some opening remarks.
Thanks, Louis. Good evening, everyone. Thank you so much for joining us for the second in our family workshop series. Tonight, we're going to be talking about understanding disability classifications and special education eligibility. I do want to take a moment to introduce the superintendent who's joining us tonight, Dr. D'Antona. If you want to share some remarks before we get started.
Hi, good evening, everyone. Really happy to see that you guys are on this call. Understanding disability classifications and eligibility, really super important. I do encourage you as the session goes on with Nathan to please be sure to add any questions that you may have into the chat. This is a great opportunity to hear from Nathan, who does just an amazing job for us here in District 25, making sure that all of our parents and building leaders are supported in the area of special education. So I encourage you to ask any of those questions as things come up during tonight's presentation. And Nathan, I'm going to turn it over to you. Thanks so much.
Thank you, Dr. Mike. Again, everyone, the chat is open, so you can please put your questions as we go along in the chat. I'm probably going to save the questions for the end. We'll look back and we'll go over any of the questions. This is a general workshop on disability classifications and special education eligibility. So if you keep the questions to a more general sense in regards to the information that I'm presenting today, if there's something more specific that you have a question about that pertains, for example, to your child, you can always have my contact information. You can always reach out personally to me and we can discuss that further. And on the next slide, actually, you'll see my contact information. So here you have my name and my number. My name is Nathan Yakubov. As we mentioned, I'm the Administrator of Special Education for District 25. And like Dr. D'Antona had mentioned, I do support the families as well as the school leaders and staff with anything that has to do with special education for our district. Types of things that you can reach out for support and questions are evaluations for your child, services, assistive technology, placement, but really anything that pertains to special education, feel free to reach out. Email is the best way. You can always reach out to the district office as well and leave me a message, and we will get back to you. Okay, so for tonight's presentation, this is a lot of information, so we're going to try to move it along. And I would like to start with just the basic kind of a recap of what is an individualized education program, an IEP. When we talk about special education services, all students with disabilities who require special education services do have an IEP. And the IEP is a legal document, and it contains information about your child's interests, their strengths, their needs, and their goals in their educational program. It demonstrates, it documents how the Department of Education will provide your child with a free and appropriate public education in the least restrictive environment. And what that means is that we want to have your child educated in the most typical setting for a student their age, with the least amount of removal from the general education environment. So the first thing we want to talk about is overall eligibility. Who determines whether or not a student is eligible for special education? Not every child that is evaluated for special education, or every time a parent inquires about special education, are they always eligible? They do have to meet eligibility. Again, this is a legal process, right? And it is guided by state and federal laws, and therefore we do have guidelines that we need to follow when offering services to a child. And really the reason for that is because we don't, what I said before, we don't want to restrict a child's development or their learning and give them services that they don't necessarily need at a certain time, because whatever service we're going to be giving them, we're going to be taking them out of that typical general education setting and adding something to them that's not so typical. So we want to make sure that this is something that they need and that we're targeting this in the most correct way. So you'll see on the screen, you have those two boxes. On the one side, you have the eligible side. And in order to be eligible, a child has to meet the criteria for one or more of the disability classifications. And that's really what we're going to spend the most time talking about in today's presentation, are the different classifications. We're going to go through each one and give an overview. So in order to be eligible for special education, they need to meet the criteria for one or more of those classifications and require a special education program or related service by reason of at least one of his or her disabilities. And what that basically means is that it's not enough to say that, oh, my child has a disability. For example, they have a hearing impairment. That's a disability. Nobody's arguing with that. But does that disability now for this child require for them to get a special education program or related service because of disability? And that's really the main question, because not every child with a disability will need special education. We have children with all types and levels of development, and some children do very well in different parts of general education instruction throughout the day. So we want to make sure that their disability is really affecting their learning. Now, in order for a child not to be eligible is the other side. You see clearly if they don't meet any of the criteria that we're going to talk about, the classifications, then they would not be eligible for services. Or they do meet the criteria, but they don't require a special education program to deal with that because they have other ways that they can learn. So they don't necessarily need special education for that. Or the determining factor is the student not meeting the standards is either a lack of appropriate instruction in reading or a lack of appropriate instruction in math or limited English proficiency. So let's take a second and just focus on that last point. If a student is not doing well because the program that they're in is not appropriate for them, so they're not getting the proper instruction, they don't have the proper teacher, they don't have the proper curriculum or materials to instruct them, they're not in the right setting, that's not necessarily a special education eligible child. Same thing if they have limited English proficiency. Just because a child doesn't yet know English to the point where they can meet all the standards in the general education program doesn't mean that they need special education. Now, in any of those cases, it means that they do need support, and the school will support them and give them interventions, but that does not mean necessarily that they need special education. Okay. Okay. Just a quick note about 3K and pre-K. So we're talking about our students that are between 3 years old and 5 years old. Their process is a little bit different than school age, and what we're going to be talking about today is really focused on school age, but I just wanted to take a second to talk about 3K and pre-K. If a child is found eligible and they're at that age between 3 years old and 5 years old, they would not list on their IEP a specific disability. What they would say is a preschool student with a disability. That goes for any student 3 to 5 years old that's eligible for special education, regardless of what their disability is. It's just too early at that age for us to single them out with a specific classification. And for that reason, they just classified as a preschool student with a disability. Now, the way a preschool student would be found eligible is if they have a significant delay in any of these 5 areas that you see below. If they have a significant delay in their cognitive skills, that's their thinking and their learning, or their language and their communication, how they understand and use language, their adaptive skills, such as toileting, eating, dressing, their social emotional development, so their behavior, how they get along with others and they express their feelings, or their motor development, which can include their physical development. If they have, including delays, if they have vision delays or hearing delays, that would all be included in that. So if they have a significant delay, and when we say significant delay, that's usually about a year behind in terms of their development, then they would be eligible for services for the preschool. Or they do meet the criteria for one of the following disabilities. For example, if they have autism, deafness, deaf blindness, traumatic brain injury, if they have any of those, they would be eligible for services through preschool as well. And just like we said before, they do require special education services, because remember, just because a child has a physical disability or even a learning disability does not necessarily mean they need special education services. They may be supported by other interventions, and so we have to see from the evaluations that they also need special education. Okay, and here's just a caution. Okay, this slide is really just a caution that a student who meets the criteria for one or more of the disability classifications doesn't necessarily require a special education program or related service by reason of that disability, like I just mentioned, right? So, for example, a student who meets the criteria for other health impairment, they may be receiving medication, okay, that allows them, they have some kind of diagnosis, but yet they're taking medication, and that's allowing them to participate in the general education classroom and have access to the curriculum without special education services. They would not need special education. A student who's struggling in school with homework, for example, should be considered for special education if their disability is impacting their ability to learn and progress. So that's very important to know, right? So, for example, we may have, I'll give you the most common example, a child with autism, right? And we hear about autism a lot nowadays. So there may be a student with autism that doesn't automatically mean that they need special education services. We need to know how they're doing in terms of their ability to access and to learn. And just another caution is that any student, including students in gifted and talented programs or any other type of accelerated program, or a student who's going from grade to grade, who's accelerated in their learning, they can be eligible to receive special education programs or services, right? We're not going to say that, oh, because the student is in an accelerated program doesn't mean that they don't need the special education services. They may, and we would have to see that through the evaluations and see that that's demonstrated. Okay. Okay, so now we get to the actual disability classifications, and these are the classifications. You see there's 13 classifications. The IEP team at your school that would meet with you for your meeting, for your IEP meeting, then the IEP team does include the parent as well, you the parent, they will identify the category of disability, the classification that most affects the student's educational performance. So, a student might fall into multiple categories. You might have a child with a hearing impairment as well as a learning disability, for example. But we're going to choose only one for the IEP, and that's something that's going to be discussed at your IEP meeting with the team to determine which one most affects them so that you can make the best determination. It doesn't mean that they don't have struggles in the other areas, and that's okay. And you can bring that up, and that would be documented on the IEP. But when it comes to choosing a classification, we're going to choose the one that's most prevalent and most affects them. And now we're going to go through all these classifications one by one. So the first one we're going to talk about is autism. And the definition is there. The disability classification of autism is characterized by a developmental disability significantly affecting verbal and nonverbal communication and social interaction that adversely affects educational performance and is generally evident before age 3. Now, I wouldn't worry too much about the age. Sometimes it is picked up earlier, sometimes later. Sometimes the child wasn't evaluated yet. But it does really affect the child's communication, whether it's verbally or non-verbally, and their social interactions. And also, you can see other characteristics in that box. You can see that sometimes they engage in repetitive activities and stereotype movements. A lot of times there's resistance to environmental change or change in daily routines, or there may be unusual responses to sensory experiences. They may be very sensitive to noises or to touch, things like that. That might be evident in a student with autism also. It's important to know that although a doctor can make a classification of autism, for those who have had this experience, when our teams are making, your IEP team is making this classification, this is an educational classification of autism. Okay, this is not a medical classification. And what it's based on is on the evaluation, on the educational evaluations of your child. It's based on observations of your child in their educational setting, and it's based on different scales that the teacher will fill out. You might be asked to fill out in order to determine, how much of this is affecting your child. Um, and that's basically the gist of this classification for autism. The next one we'll move on to is deaf blindness. And for deafblindness, this disability classification is characterized by the combination of concomitant hearing and visual impairment. So what's happening is that the child is having both hearing and visual impairments. And that results in severe communication and other developmental and educational needs that cannot be accommodated in a special education program solely for students with deafness or students with visual impairment or blindness. So basically what we're looking at is to see that they have both the hearing and the visual impairment, and it's really affecting the way they communicate and their learning to a severe extent. Now, for this classification, you would need medical documentation. Some of the classifications we're going to talk about tonight, you actually do need a medical doctor to provide documentation in order for your school team to make this classification. Unlike the autism we just spoke about, again, the team is making that classification. It's an educational classification, but something like deaf blindness, we would need medical documentation in order to determine the need for that, in addition to the evaluations in order to determine how this disability is now affecting their learning. The next classification is deafness, and this is characterized by hearing impairment so severe that it impairs the processing of linguistic information through hearing, with or without amplification, and adversely affects educational performance. So it's really affecting their processing of information, right? How they're hearing information that's being presented to them, whether or not they have, let's say, hearing aids to amplify that, the amplification. But if it's affecting their educational performance, they would be diagnosed with this classification as well. Now, for this one also, we do need to have medical documentation, and usually that would be an audiogram from an audiologist, which is specific for hearing impairments, and they would see specifically the extent of that hearing loss. That would be needed. The New York City Public Schools also has audiologists on that work for the New York City Public Schools. They would review that information as well, because they are the experts in that area. And together with the team, they would make a recommendation of whether or not this would be appropriate. And something that might come out from this as well is that the student might be recommended for a teacher of hearing or specific hearing services to address in this area. Okay, the next classification is emotional disturbance. And this has one or more of the following characteristics exhibited over a long period of time. So we're not talking about that the child maybe has, an occasional outburst, right? We're looking for something that's over a long period of time and to a marked degree that adversely affects their educational performance. And you have some of the characteristics over here in the box. An inability to learn that cannot be explained by intellectual, sensory, or health factors, which means that they have the intellect to do it, health is there, but something emotionally that's holding them back. Or they have an inability to build or maintain satisfactory interpersonal relationships with peers or with teachers, right? They can't build those relationships or maintain them. They have inappropriate types of behaviors or feelings under normal circumstances, right? We're not talking about some of us, everybody stresses out at different times, but we're talking about under normal circumstances, they can't cope with that. And they may have a generally pervasive mood of unhappiness or depression, and they may have a tendency to develop physical symptoms or fears associated with personal or with school problems. This classification would be appropriate for a student who has actually a diagnosis of schizophrenia. This would be appropriate for them as well. So we're talking about a severe emotional difficulties and delays. And over here, this is just kind of again a cautionary slide. When we talk about social maladjustment, and what that means is that there are certain behaviors that negatively affect performance, it's not always the basis for emotional disturbance. So what you might see in a case of social maladjustment, you might see some of these things below. Let's say there's a dysfunctional family background, um, gang involvement, not coming to school, irritability or anger, obscene and degrading language and gestures may be common. So a student who is socially maladjusted will often exhibit explosive verbal and physical aggression. They may have very high esteem, but it's very fragile. So, anything can make them fall apart. They may have a refusal to take personal responsibility and tendency to project blame onto others or events. They may have values and morality that are determined by the situation, meaning, immediate gratification, whatever goes at that moment, that's what they're going to do. There may be substance or alcohol abuse, drug abuse, or we may see a lack of empathy or remorse. Sometimes it's described as the person not having a conscience, that they just don't care, or not interested in other people's opinions and judgments. So this would be social maladjustment, and obviously this would have to be addressed as well and supported. But this is not necessarily the same thing as emotional disturbance. Emotional disturbance really refers to the things on the other slide that we said in terms of that. But we may see a child or a student that's socially maladjusted by itself, and that's something that we would have to address in other ways. But again, if they have emotional disturbance, you may see some of these types of behaviors as a result of that, as well. Okay, moving along, the next classification is hearing impairment, and that's an impairment in hearing, whether permanent or fluctuating, that adversely affects educational performance, but is not included under the definition of deafness. So they're not meeting the criteria of deafness. And again, we would need medical documentation, just like when we were checking for deafness, to see the extent of their hearing loss, where they may fall under hearing impairment instead of deafness. That's something again that we would be guided by an audiologist in order to make that classification. The next disability classification is learning disability, and this is a broader disability. It's in one of the more basic psychological processes involved in understanding or in using language, spoken or written, that manifests itself in an imperfect ability to listen, think, speak, read, write, spell, or do mathematical calculations. And again, that's a lot, saying a lot, but it's really, the inability for them to learn in the most, appropriate manner. And we see this, sometimes you'll see such conditions as brain injury or dyslexia. Those would fall under, having a learning disability as well. So, how do we determine a learning disability? If you look in the box, I outlined the procedure for that. The IEP team may not rely on any single one procedure as a sole criterion for determining whether or not a student has a learning disability. So what we want to do is make sure that we're getting information from all a few different points, so we can really pinpoint if this is a learning disability or if there's something else that's involved over here. So the evaluation must include information from an observation of the student in routine classroom instruction, and then we want to monitor their performance. It could be done before or after they were referred. It must be conducted by at least one person qualified to do these types of diagnostic examinations. So we want the observation to be done by either a school psychologist, let's say a reading teacher, or a teacher of speech improvement, somebody who's able to do diagnostic types of evaluations. And then we want to ensure that underachievement in a student that's suspected of a learning disability is not due to a lack of appropriate instruction. Again, like we said before, right? We want to make sure that they're getting all the proper instruction, they have all the supports, all the tools that are necessary in that classroom, and yet they're not able to get it. They're not able to progress and to achieve. So the IEP team must consider data that demonstrates the student was provided the appropriate instruction, in the general education setting, and they have to see database documentation of repeated assessments of achievement at reasonable points, which reflects a formal assessment of student progress. So we want to make sure that, what was going on over here. Were we giving the instruction? Were we assessing that instruction? And how were they doing? So we're really taking our time to really focus and make sure that this is not just something that can be corrected in the general education classroom, but rather this is something that requires more intervention. And the IEP team may determine that a student has a learning disability if, when provided with learning experiences and instruction that are appropriate for the child, the student does not achieve in one or more of the following areas. So again, we have everything set up. They're in the right classroom. They have the right teacher, but they're not making progress in their oral expression, their speaking, right? Their listening comprehension, their reading expression, their basic reading skills, their math, and they're not making sufficient progress to meet age or state approved grade level standards in one of those areas. And even though they've been getting scientific research-based intervention in that classroom, or we see a pattern of strengths and weaknesses um, that the IEP is determining, the IEP team is determining, that are relevant to the identification of this learning disability. Again, using appropriate assessments. So there's a lot of information on this slide, but basically what we're trying to say over here is that we want to make sure that the student receives adequate instruction first. And when we say adequate instruction, that also means supports, because students in general education, they're also getting supports. They're also getting intervention, right, before they move on to special education. So we want to make sure that they've received all of that support first, and we've demonstrated that they're not making the progress that we would expect based on that intervention and their age and their level, that we can consider learning disability. Okay, the next classification is intellectual disability. This is characterized by significantly sub-average general intellectual functioning. And it exists concurrently with deficit in adaptive behavior, and then manifested during the developmental period that adversely affects educational performance. So, this is really low functioning in terms of the intellectual abilities for a student. And you would also see adaptive issues here. For example, taking care of themselves. You might see difficulties with dressing, with feeding, with advocating for themselves. This does take a time to determine this diagnosis again, because we'd have to go through the steps to make sure. And it's really severe, this classification. So we're not going to see a lot of students with this classification of intellectual disability. And so we want to make sure that the student really falls under this criteria. Okay, the next one is multiple disabilities, and this classification is characterized by concomitant impairment. So we see a combination of disabilities happening at the same time with this student. Now, multiple disabilities does not include deaf blindness. That's a separate classification that we already spoke about. But typically, the classification of multiple disabilities, it denotes a severe intellectual disability, like we were just talking about, in addition to another significant area of disability. So, for example, the child might have an orthopedic issue as well as intellectual disability. They would fall under multiple disabilities. Or they may have an intellectual disability as well as an emotional disturbance. The child like that might fall under multiple disabilities. Again, for this, we would need a medical evaluation as well. For example, an orthopedic assessment, if that's what we're talking about, or depending on the other disabilities that are happening with the student, we might need a medical evaluation. And we may need a behavior scale to see how they're doing in terms of that as well. Again, depending on the disabilities that we're looking at for the specific student. Okay, orthopedic impairment is characterized by severe physical impairment. Okay, so up to this point, we were talking about emotional learning, and now this classification is actually talking about physical impairment that adversely affects the student's performance. And this can include congenital anomalies. So, for example, if they were born with something, a clubfoot, or an absence of some part of their body, it could be something that was caused by disease, at some point in their life, or something from other causes. For example, cerebral palsy, a fracture or burn, which affected them. Again, we would need a medical evaluation for this in order to make this classification, because we're looking at the physical impairment over here. So we would need a medical evaluation for that as well to be shared with the team in order to determine the needs and the services. The next classification is other health impairment. So other health impairment is characterized by impaired strength, vitality, or alertness, including if they're very alert, they have a heightened alertness to certain stimuli, right? Like very alert to certain sounds or sights. That might also be, and that results in limited alertness with respect to the educational environment. So they're overstimulated with other things and they're not able to participate in the classroom. The impairment must be due to chronic or acute health problems, and it can include, but not limited to, a heart condition, um, asthma, epilepsy, lead poisoning, diabetes, attention deficit hyperactivity disorder, right? ADHD. A lot of times, most of the times when I've seen this classification has been for those types of students. But it's important to know, like we've been speaking all along, the impairment must adversely affect educational performance, right? So not every child with ADD or ADHD, will be affected negatively in their classroom. Some children might be on medication. Also with epilepsy, right? The child might be taking medication that's able to have them function. It's helping them to function throughout the classroom. So it's not affecting their educational performance. On the other hand, they may need special education intervention, and they would be classified with this classification. The next classification is speech or language impairment, and this includes communication disorders such as stuttering, impaired articulation, right, how they produce the sounds, a language impairment, or voice impairment even, that adversely affects their educational performance. So for this, we don't need medical documentation, but we do need a speech and a language evaluation, right? We have speech and language pathologists. They would evaluate the child in this area to make that classification. And again, they would be part of that evaluation would be part of the IEP team. Um, and again, this could be expressive or receptive language. Expressive is how they use their language, and receptive is how they understand language. If any of those are impaired significantly, they may fall under this criteria. Articulation, I know this question comes up a lot, especially with the younger children. If they're not producing the sounds right, some of that is typical and developmental and normal for children. All of us who have children know that. But sometimes as parents, we get overly concerned for that. And so that's why we would need a speech language evaluation to determine, is this something that's out of the norm? Or is this something that over time will be corrected, or maybe it needs intervention? And again, overall, like I said, it has to be affecting their educational performance. So you may have a child who even stutters, right? Let's take that example. But if they're able to learn and perform in the classroom, and they have certain, strategies to compensate for that, they wouldn't necessarily need speech or language, this classification, or even special education services. Okay, the next one is traumatic brain injury, and this is characterized by an acquired um, injury to the brain caused by an external physical force. Right? So like if they basically been hit to the brain, or by certain medical conditions, for example, a stroke or an aneurysm, and now this impairment adversely affects educational performance. Again, we would need a medical evaluation for this. Generally, be, for example, like a neurological examination would be required to make this classification for a child that we suspect. And it's important to know it can include either open or closed head injuries or brain injuries, even from certain medical conditions that result in mild or moderate or severe impairments in one of the following areas, one or more of the following areas. It could be affecting their cognition, right, their understanding, their language, their memory, their attention, their abstract thinking, their problem solving, their speech, or their sensory and motor abilities. And any of those things might be affected by a traumatic brain injury, and we would have to, determine if this is affecting them in their educational performance. Traumatic brain injury does not include injuries that are congenital or caused by birth trauma. Okay, that would fall under a different classification if we would see that, but it would not necessarily be traumatic brain injury is something that would come after that. Okay, the next one is visual impairment. Actually, the last one we're going to discuss tonight is visual impairment, and I want to give time for questions as well. The last one is visual impairment, and that classification is characterized by an impairment to vision that even with correction, right? So we're not talking about, a child who's able to just wear glasses, and be able to see the board. That wouldn't be a visual impairment. But we're talking about that even with correction, it's adversely affecting their educational performance. And this can include both partial sight and blindness. And again, we would need a medical evaluation for this. Usually an ophthalmologist would make that determination in terms of the extent of their delay. We do have an Office of Vision Services at the New York City Public Schools that we would consult with in a case like this to determine if they meet the criteria and how best to make those recommendations in terms of what type of vision services and supports the child would need. So that would be part of that process for visual impairment. And that brings us to the end of the classifications. Just this slide is just our contact information for District 25. Like I said, you have my contact information in the beginning of the slides. The office contact, you can always reach out. And we do have translation as well available if you have any questions. And like I mentioned in the beginning, if you have any specific questions pertaining to your child, you can always reach out to me as well. Now I know that there was a lot of information in this presentation. Because just by the nature of the material, we're talking about the disability classification. So if you need to take time and get the slides and look over those and review those, if you have any follow-up questions after that, you can always reach out to me again. In terms of that, if you have any questions about your own child's classification and understanding why they were classified like that, this would be helpful. And I hope that this is actually helpful for you to really understand more about your child's IEP and the services that they're getting, or the services that you might want to consider for them as well. So what I'm going to do now is I'm going to stop sharing my screen just so I can take a better look at the questions in the chat if there are any.
For whatever it is you want.
Yep, we got a few. I've been collecting
Okay.
them.
Great, thanks. And then
Take
also, if
white
anybody
flour,
wants
use
to,
this flour to make pizza dough, or I'll do this to
hold
make
on,
these.
somebody's unmuted. If you could just stay on mute. So if anybody wants to come off mute and ask a question, we could do that as well. We have some
Yeah, you
time.
can raise your hand. I'm also going to ask our interpreters to ask if there's any questions in their rooms. But Nathan, the first question I have for you came pretty early in the presentation at 6:07. And the question is, I think this is a good place for you to kind of discuss a little bit. Where do I find out which elementary schools in District 25 offer classes of 12 students, so I guess like a self-contained setting, for kindergarten?
Okay, thanks. So yeah, I see the question from Lindsay.
Yep.
And that's a good question. And actually our next workshop that we're going to have, I think in March, is going to be on the kindergarten IEP process. So I encourage you to definitely sign up for that, and any parents who want to join us for that. We're going to go through that process. It is a complicated, sometimes confusing process. And that's really where you're going to have that recommendation, and they're going to guide you through the transition to kindergarten. But generally speaking, just quickly, if your child is getting services now, you will be having a meeting prior to them transitioning to kindergarten. And at that meeting, they will make a determination. You haven't had that yet. It's too early for that. But you should have that meeting soon. And they're going to determine if your child is recommended for a class of 12. Following that meeting, you will get an offer to a school that does have that class. In the meantime, all our schools offer different levels of special education supports, and you can check any school on their New York City Public Schools website. You can see the types of classes that they have, and then you can always reach out to the school and ask them, do they have that class for kindergarten? I would say kindergarten, a lot of our schools have a kindergarten class just because, there are always new students coming in, but that's definitely something, if you're interested in a school, you can always reach out and have that discussion with them. And then look at their website. It will say like, which grades they have special education for. And then, like I said, after your meeting, you'll actually get a school that will have that classroom, and you'll have a chance to outreach to that school and see the classroom before you register for that. We have a question from
and Lindsay, I just want to say to Lindsay, like kind of what Aidan just said, almost every elementary school will have that setting in kindergarten. So definitely check in with your zone school. They will be able to most likely be able to service your child, but you'll wait till you go through the kindergarten IEP process. All right, Nathan, you see the next one?
Yeah, I see the next one, but I did see somebody's hand up also.
Oh, sure.
Did you see that? I think it went down. I don't know what. Did somebody have their hand up?
I have a
Double-
question.
Oh, go ahead. Who's that?
Yeah, this
Yes.
is Lindsay. This is the
Oh,
the
hello.
hi.
Oh, Lindsay, hey.
Yeah, hi. So my I have twins. So the reason I'm
Okay.
asking is because one needs to be in a self-contained class of 12
Mhm.
and the other doesn't, and I don't want to separate them either.
Oh,
I mean, that's
separate them their
understood.
class or their school?
Because right now they're in preschool. One is in a class of 10 and they're gonna recommend him to be in a class of 12.
So
For
you just want the twins to be in the same school, not the same class.
no, not the same class, the same school.
Okay.
Yeah, but
Yeah.
there's
So
elementary schools near me, but it doesn't, it says special education on their
yeah,
website, but it doesn't say self-contained class of 12.
yeah. Most of our schools will offer that in kindergarten. I would suggest starting with your zone school, the school
Okay.
that's zoned to your address, and see if they offer that. That will be your best chance at getting both kids into the same school, and to get your one child into the appropriate setting.
Okay. All right.
Yeah, you should be okay. Yeah, and if you want to message me privately your zone school, I can also check for you if you want.
Okay. Thank you.
Yeah, you got it.
Okay, great. I see Cynthia. Cynthia's hand up. Go ahead, Cynthia.
Yes,
Oh, hey,
hi, how are
Cynthia.
you? Hi, how are
Good.
you?
Good.
So I do have a quick question. My son is currently actually in the 4th grade, started in a self-contained, was then put into an ICT class.
Okay.
He was doing okay, not doing as well anymore. And the self-contained, I think, is not a good setting for him, but the ICT seems to be a little too overwhelming for him because there's 34 kids in his class. So at this point, I'm not really sure what to do, because he is going to be graduating next year, hopefully, and was hoping to possibly look into transitioning him into the NEST program, but was told it's almost impossible.
So, I mean, Cynthia, that's definitely something you want to discuss, with your school team. And if you're having any difficulty reaching out to anybody, you can always reach out to me as well. Let me know what the response has been. But we want to start with your school team and let them know your concerns and what they feel in terms of where your child is at now, if they've seen the same concerns that you're seeing, and what they're proposing to do about that. And in terms of Nest, I mean, if you that's something that you want to consider, then talk to the team as well. They will help you complete that application. And I would encourage you to do that for your child because
Yeah.
that program is constantly expanding. So things are opening, and you'll never know unless you actually complete the application. So
Yeah, I actually did that already
great.
because, yeah, and speaking with them, I think they're all kind of on board with me. I guess my concern is really the fact that it was stressed to me, and I was like a little concerned about that, honestly, that it's very hard to get into the program.
Well,
For Nest,
there's limited seats in the program.
Yeah,
And oftentimes when students are in that program, they don't leave.
I was told. I
Yeah.
was
So
told,
that's
and
the only reason why you were told that. It wasn't for any
yeah,
other
no,
reason than
I totally
yeah.
get it, and I feel like, I mean, not to divulge too much online because I know there's a lot of other people, but I almost feel like I made a mistake when I initially picked the program for my son.
Oh.
Because maybe I should have gone with the Nest program, and it's all kinds of like guilt and everything. But is there a chance that in the 5th grade, or when he graduates from the 5th grade, that there's a better chance for him to get into a Nest program?
I don't think it really depends on the grade. It just depends on on the program availability. And
Okay.
also they'll have their criteria, so they're gonna review the application
Yeah.
and may do their own
Okay.
evaluation as well.
Okay.
The timing is important, and we do see lots of children transitioning over the summer to other schools.
Mm-hmm.
So entering grade 5, like into September timeframe, might be a better chance. But Nathan and I, we
Yeah.
can't
Okay.
Yeah,
be for
and
sure.
Cynthia, hi. One
Mhm.
of the things that Nathan started off with, I think, is probably the most important step right now, is really engaging the school team and really talking about the things that you're seeing, the things that they're seeing, and then organize the supports that we can provide right now in the school that he's currently in.
Yeah. I
Certainly
spoke to
always,
them. I
yeah,
did.
certainly
They've
always
been. I'm
the
sorry.
application
They've been
certainly.
good.
Yeah.
It's just I'm concerned.
No,
'Cause,
of course, it's
you
your
know.
child, of course. Yeah.
Okay. I appreciate it. Thank you. They've been
and
great.
email-
It's just, I'm scared.
Email
you know?
email Nathan. Email Nathan.
Yeah,
Thank you,
connect with
Cynthia.
Nathan, and then we could talk you through any of that stuff too, because, you know,
Yeah.
the process of making sure that our kids get everything that they need, you know, certainly I know brings a great deal of anxiety, because you want to make sure you're helping make the right choices. So I totally get it.
Yeah.
You know, Nathan is there, the school is there, and
Yeah.
don't hesitate in putting in those applications. Don't worry about what the odds are. You won't
Yeah.
know unless you give it an opportunity.
Yeah, I appreciate it. Thank you, guys. Nathan, just remember my name because you
Okay.
might see something.
No problem, Cynthia.
Email Nathan.
Okay.
All right,
Angela,
Nathan, before we do
Yeah.
before we go to another hand, can we just do some quick
in the
chat
chat.
questions?
Okay, so we see.
Yeah, what is the
Christine.
difference between CPSE and IEP?
Yeah, Christine. And then you also asked about the 3K
Yes.
child on CPSE who needs speech therapy. It seems difficult to find one right now. So CPSE is the Committee on Preschool Special Education, and the IEP is the same for preschool student or school age student. That's that document that we spoke about that outlines the services that your child is going to get. The CPSE is the actual department within the New York City Public Schools that's going to oversee the services for your child during preschool. It's possible that right now speech therapy is difficult to find a speech therapist. I recommend that you continue to follow up with your administrator and with the CPSC office. If you need help with that contact, you can reach out to me. But it is a difficult time. Things may open up closer up to the summer, maybe for next year. You can also ask if your child is in an actual 3K program. You can see if there's a provider maybe that comes to the program for other students, and they may have availability. And then once a provider is found, you can always ask for some makeup services for that if you weren't able to get that until that point. But it is difficult, at this point of the year to find providers. That's just the reality. So that might be happening. And then also you can see, depending on your child's needs, maybe there's other ways they can support their language needs in that classroom as well. And that's something you could talk about with the teacher and with your CPSE administrator as well. Okay, and then Christine, you also asked what is special class versus special school. A special class, and we didn't talk about in this session the different types of special education services, but in our community schools, we do have a special class, which is a class where there's not more than 12 students that all have an IEP in that classroom, and they're supported by a teacher and a paraprofessional. We may have also District 75 is our branch of specialized schools. And what that means is that those schools, every student in that school has an IEP, and they're getting some type of special education services, as opposed to our community schools where we have general education as well. Okay. I
Do you want to go
see-
to the raised
next-
hands?
Okay, sure. Angela?
Sure. Hey, Angela. We see you.
I'm
How you
sorry.
doing?
Okay,
That's
hi.
okay. Go ahead.
I have two questions. My first question is, our son currently has an IEP, and he's currently in 5th grade. Would he be able to carry it through to junior high?
Did the IEP carry over to junior high is your question?
Yeah.
Yeah. So before he, I mean, I don't know when his annual review, but once a year, as you know, you have an annual review. This year, when you have your annual review, the team should be preparing in that annual review. They'll be setting up a plan for middle school for him as well. So the IEP might look a little bit different for middle school in terms of the class size, depending on what he's getting. So that's something you would talk about with the team, and they would set that in motion. And then yes, that IEP will follow him to middle school as long as he still, needs special education and he's qualified for that.
He had the evaluation in October last year.
So you probably should be due for one already. So I would speak to the school and see where they are at with that.
He had it in October.
October this year.
2024.
This school year. This school year.
October.
Oh yeah, sorry.
Yeah. This past
We
October.
think school years.
So I was just thinking that you
Yeah,
were
yeah,
them in
yeah.
24.
So then that IEP will follow him for now. Yeah. Into junior high. Yeah.
So the other question is, he was a GNT student and upon his diagnosis of ADHD, we pulled him out of GNT, so he's now general ed. But apparently his level of intelligence is at the level of the NEST program, but he doesn't have a diagnosis for autism. Is there something outside of school that he would somehow meet a requirement or something? Because the junior high he's going to go to doesn't have that.
Are there concerns that he might be a student with autism?
It's possible, but when we had him evaluated with the neurologist, she did not do that diagnosis. She definitely confirmed his diagnosis for ADHD, which was previously confirmed through another person.
I mean, that's something you could speak about with the school team right now and see if they are able to see some of the concerns. They could start with maybe some screening for that. Maybe have, you complete some scales, some rating scales where they determine if he may be on that trajectory, and then they can, meet with you and they can always change that classification if you would meet the criteria. So I would start with them first. Nest Horizon, those are autism programs for students with autism. So he would need that classification for you to apply for that. But I would start with the school team first to see if they see any of those characteristics and concerns. And if yes, maybe they can start that process to reevaluate him.
Okay, thank you so
All right,
much.
no problem. Okay,
Thanks, Angela. Thanks for coming.
we see Evelise.
Hi,
Yes.
Evelise.
Hi, guys. Hi. I have two quick questions.
Sure.
My daughter, one is like a concern or comment. My daughter is
Sure.
currently on a Horizon program in 4th grade. And she's,
Okay.
as you guys know, for autism, the girls are like the minimum population. So she's the only child or only
Got
girl
it.
in her classroom. So with that being said, it's very hard for her to socialize with girls. It's something that you guys, and I know that other classes looks the same. I don't know if something that you guys can take a piggyback and see how these things can work, because we as the parents, it's very limited and hard for us to get socialization like girls. Now she said, oh, mommy, I'm going to have a play day. I'm going to have a girl. So it's very hard for parents to accommodate that at school because they don't have the population. And I know that those kids are sent from you guys to the schools. So it's something that you guys are planning or you guys are aware of that.
I mean, not really. I mean, it depends, if you have students that are zoned for certain schools, depends, the population that's around that school. Then we have, certain students that do come to the schools, let's say for certain special education supports, but it's very hard to forecast, what type of students are going to come at any given time. And so, we really have to kind of balance that. That's something that, again, you should speak with the school team, where is the best supports for her in terms of that? Is it that special education classroom where there's only boys, or maybe even there's certain times of the day where she can be in another classroom and get different types of supports and have exposure to more females? That's something that the school can help you to balance, but it's very hard for us to predetermine that.
I no, thank you. I understand. Following for my next question,
Sure.
because she's like easily distracted. I know to get a para is more like for kids that have behavioral problems. That's what I get when I request. So in that sense, if she can go based on her situation, can she get like a para or someone to assist her to go to the bigger classes where other girls are, so she can participate and have the support that she needs?
I mean, like you mentioned, one of the types of paraprofessionals that we do have is for crisis or behavior management, right? So your child would have to have significant behaviors that are affecting her or other students in order to qualify for that. That doesn't sound like she's that type of child. If it's just concerns of, her adjusting into that classroom, that's really something that the teacher should focus on. And there's different strategies that they can do for that. The other type of paraprofessional would be a health paraprofessional if your child has some type of health needs. But generally just for, transitioning to a larger class or refocusing, that's really something we expect all kids, to be supported with their teacher in terms of specifically that in in their classroom. So I would start like it goes back to what I said in the first part of the question. Maybe for a short period of time, it would help her to adjust to another class for certain periods, and then that would give her the ability also to transition easier, where it's not just full day. I'm coming from the small class, now I'm being thrown into a large class.
Thank you. So that's something that I can talk to the teacher, the school?
Yeah,
or-
absolutely. Yeah, you should.
Yeah, absolutely bring that to the school and engage in that conversation for sure.
Oh, thank you, guys. Thank you. I will do that, and I will rephrase that I participate in your meeting so they know that it comes from a
That's
place.
right.
Yeah,
Just drop
absolutely.
Nathan's
100%.
name. Drop
Thank
Nathan's
100%.
name.
Feel free.
No problem.
God, Nathan, I have your name.
Tell them you're friends with Nathan.
No,
You're friends
no
with
problem.
Nathan.
So
Thank you,
I
guys.
see.
Thank you.
Just going back to the chat, I see from Nadia, my daughter is in 3K. She was diagnosed with autism. Which classification does she fall under? I missed the initial part of the presentation. So Nadia, and you can get access to these slides and the recording, but just quickly, 3K, we don't diagnose with autism, even though your child may have that diagnosis from a medical doctor, and that's fine. But on the IEP, it would only say preschool student with a disability. That's for all students in preschool, regardless of their diagnosis. If they're eligible for special education, then it would show preschool student with a disability. So that would be her classification. At your kindergarten meeting, which we'll talk about at our next session in March, that will come up and they will discuss and determine with you if she should have a classification of autism or something else for her kindergarten. Then I see
And do we
from
want? I know Gabriella asked to ask
it's
a question
Spanish,
in
yeah.
Spanish.
Do we have it?
So if Gabriella, if you're on, you can go ahead and unmute yourself and ask in Spanish, and we can have one of the interpreters translate for you. Or if you're in the Spanish room, if the interpreter can ask your question. Okay. So Gabriella, anytime if you're still here, you can unmute yourself and you can ask your question. We'll get you the answer.
Right, and then I see from
Let's keep
Dorothy, she
going.
just
Yep.
put in some ADHD and attentive affects math function. When he should be, okay, I guess this is about your child maybe, and says other kids were doing it. Is this enough to go from 504 to an IEP? So I mean, I'm just gonna try to understand what you're saying, Dorothy. Perhaps your child has a 504. If a child has a 504, they can transition to an IEP if there's something that qualifies them for that, based on everything that we discussed today. But more importantly, I just want to say, because you're saying that other kids were doing it, that's part of the equation, right? When we want to determine if a child needs special education services, like I said throughout the presentation, we want to check how they're doing towards the standards. And also part of that is how they're doing vis-a-vis the other students in their level, in their classroom, in their grade level. And if that's something that's abnormal, or if it's something that's typical for that grade level and for the grade age. So that's something that we want to talk about with the team and make sure that they need extra support. But if it's just going from 504 to IEP, generally 504 would be more for medical issues. If there's something more that's affecting them as a whole on their education and their learning, then they would transition to an IEP. From Zoom user, I see, can a child get accepted in GAT kindergarten class, have an IEP and receive related services? Absolutely. That was on one of the slides. Being in a GAT class does not hold them back from getting special education services. So let's say they need speech therapy as well, that would be fine. They would have an IEP and they would see that. Just make sure that at your kindergarten meeting, you're bringing that up and you're letting them know, if you've already gone through that process, that your child will be going to the GNT. Let's see how to contact me. iPhone on the slides is my information. Dorothy is saying from 4th grade. Okay, I think I answered that. And
Louis,
okay,
if we can just have our Spanish, one of our Spanish interpreters just kind of echo Louis about Gabriella, who put it in the
Sure.
chat, to make sure that she knows that we were saying that she can come off of mute.
Absolutely. Yeah. So go on to the Spanish interpreters in the Zoom.
Yes.
Yeah, go ahead.
I have her on the line. So
great.
Oh, great.
she just informed me that her daughter was diagnosed with short-term memory, and her daughter has some difficulties to math learning, and English speaker, and she's wondering if it's that a disability. I mean, the short-term memory.
So, I mean, it's a good question, and based on everything that we've been discussing tonight, it may or may not be. And so, if she is concerned, then the first step would be to speak with the team so that they can do a more thorough evaluation. Being that she is a bilingual student, right, and she is exposed to another language other than English. So what we would do is have a bilingual evaluation in Spanish as well, in order to make sure and to determine that it's not a lack of English skills that's holding her back, but it's actually a learning disability possibly. So I can't say yes or no without knowing anything here, but it's definitely, if she has cause for concern and she feels that her child is not up to par with what she's being given in the classroom, and she's having a difficulty and struggling, then that's something that she should start that conversation with her school, and let them start that process.
Thank you.
Okay, great. And Nadia, I just see in the chat that going back to your daughter, she was given temporary diagnosis of autism after evaluation for IEP services. Again, that diagnosis of autism would come from outside, either from your medical doctor or somebody, I assume, because a CPSC would not give that. They would just write preschool student with a disability. So if that's something that you're concerned about and you want to pursue that further, you may. It doesn't really affect her at this point. If she has an IEP, she's getting the services that are outlined on the IEP. But as you move to kindergarten, when you have that meeting before kindergarten, they're going to revisit that and make sure that that's still appropriate for her to put on her IEP for kindergarten. Okay, I think we exhausted everything in the chat. I don't see any other questions or comments. Interpreters, if there are any questions in your rooms, or if anybody else has a question on the call that they want to raise their hand, please feel free.
Okay, there's no further question on the Mandarin 9.
Thank you.
Thank you.
No questions so far.
Good, thank you. So I put in the chat the link to get your tickets for the next Nathan show. I mean, the next session, Tuesday, March 18th. Same place, Zoom at 6 p.m. All about the kindergarten IEP process. We understand that this topic is a little bit more nuanced because it really only focuses on a small group of families that have a student entering kindergarten. But we had lots of questions today about that age group. So we do encourage everyone to register for that session. And you can get your tickets now, and then we'll remind you as we get closer to the event about it. So I have that link in the chat. Are there any more questions before we wrap up? I know we're a little bit over time.
Just somebody's asking where they can get the recording, Louis.
Oh, sure. So if you go to the same website you went for the Zoom link, the event website, d25.nyc/event, there will be a button towards the top of the page that says like recorded workshops or something. And you click that and it will just shoot you over to YouTube, and the button says recorded parent meetings and workshops. And it'll go to YouTube, and we order them in the most recent one on top. So sometime tomorrow, I'll upload this video to YouTube, and it will be at the top of the playlist. You'll see it there. And you can even go back and watch Nathan's first session from a few weeks ago. But that's a good question. This was a good meeting. And of course, all the slides are available right now. If you wanted to read through them right now, I'll put them back in the chat. Also, it's on the website. But this is the slides for today.
Yeah, for our parents that were able to join, we really appreciate that you took the time to learn a little bit more about the IEP process, particularly in this case around classification. Really super important. The more informed you are as parents, the better choices that you're able to help make for your own child. So thank you so much for being here. Nathan, thank you as always. Louis, thank you as always. And all of our interpreters, thank you for being here to help out tonight.
No problem. Thank
right.
you again, everybody who joined. The process to apply for kindergarten, I guess. Christine,
4K is another way of
pre-K?
saying pre-K.
Yeah.
Pre-K, okay.
Pre-K, we call them 4K sometimes.
I
So,
believe it's open now, right?
Yeah, the window
Well, yeah.
window opens in a couple of days, I think. Tomorrow.
Yeah, I'll check the website real quick and on those dates. But just to apply for pre-K is just like you apply for any other grade in New York City. You're going to go on to the My Schools website, make an account, You'll be able to look at a catalog of all the pre-K programs in your area, or in this case, throughout the city. And you put in your application. You can rank all your choices and you put in your application. The application for pre-K opens tomorrow. Dr. Mike was right, Wednesday, January 15th. It closes on Friday, February 28th. So you have a really big window to apply. There's no rush to apply. It's not first come, first serve. Applications submitted on the January 15th are seen exactly the same as applications submitted on February 28th. And then we expect pre-K offers to be released on or around Tuesday, May 13th. So that is all about pre-K. And I'll put that in the chat as well for Christine.
Thank you. This is Christine.
Yeah. Hey, Christine.
Hi. Hi. So since my son has an IEP and also is in CPSE, how can I find out the school that offer the class that for I think it's 12 people?
So,
I mean, like I said,
pre-K.
you're gonna apply. You're gonna go through the regular process for application for pre-K. You want to make sure you do that, and then a little bit further in the year, you're gonna have a meeting for your IEP for pre-K. That's going to be a separate process, and then depending on what they recommend for that IEP, you'll receive a school offer for a school that does have that class. Okay, but we want you to also apply for regular pre-K because it's possible that the school that you apply for with pre-K may have that class as well, and you want to have that spot in that school. You know, and also things may change. Your child might not even need that service by that time. So you want to make sure that you got that out of the way, and then at the same time, you're going to have an IEP meeting later on in the year to determine what services she needs for kindergarten for the IEP, and you'll get a school offer that has that classroom.
Okay, I see. So I just apply for the regular one. If the school offer a special class, then based on the IEP, he will get accepted for the school. Okay, got it. Thank you.
All right. Okay.
All right. Are there any more questions before we wrap up? Do our interpreters have any more questions? All right, so I'm gonna go ahead and call it a night. We
Excuse
thank
me,
everyone
we
for
have
joining.
a question in
Oh,
Spanish.
sure.
Sí, dígame.
Yes.
Disculpe, ¿pequeño solo para ya de 2 años a 3 años en adelante o hay para niños como de 1 año o 11 meses? ¿Hay algo así en la escuela para ellos o no?
Okay. Pre-K for kids from 2 to 3 years, or there's a program for kids for 1 year and on?
So for special education, we're talking about students that are 3 years old to 5 years old. If the mom needs something for a child that's younger than 3 years old, that would go through the early intervention program for New York City, and she can call 311 to ask for a reference for that. They'll give her a number to call for that. That doesn't go through the New York City Public Schools. From birth to 3 years old, that would go through the early intervention program. And parents can call 311 and let them know that they want support with services for that.
Thank you.
Welcome.
Great. All right, everyone. We hope everyone got a lot of good information today. I'm going to go ahead and stop the recording, and we will upload it onto YouTube tomorrow for you guys to watch again or share. But if there's nothing else tonight, we're going to go ahead and end the meeting. I want to thank Nathan and everyone for joining, and have a great night. Thank you,
Thanks,
interpreters,
everyone.
as well.
Yes, thank you, interpreters. Thanks.
Thanks. Good night.
Great job, Nathan.
Thanks, Dr. Mike.
I got to touch base with you on a comment that was private message to me tomorrow.
Okay. That
Yeah.
good or bad?
Yeah, no, not bad.
Who's
Not